I think after so many deaths, I just kind of had to come away. I just had to step away because I'm a people person, so I was real engaged in lives, and the position wanted me to be engaged in every aspect, you know, from going and getting them, waking them up, to help get them dressed, to take them to the doctor, you know, the babies, the parents, you know, taking them to the grocery store, you know, just going someplace where we just kind of hang out and feel okay about life. I started seeing things on television, where they were talking about HIV and the gay white men. And so my whole first introduction was that it was, to me, a gay white man's disease, you know. And first thing I said when I saw it and they were talking about it, I said, wow, that is too bad. You know, that's really sad, you know, that's happening. So, you know, just started getting more information and being told that, you know, no, it's not just for, you know, that it's for happening to gay white people, and it's happening to all people, you know, and that it's and then they just started telling me more information about what it was, you know, the virus that it was, and the disease that, you know, AIDS grew into, you know, that it would develop into. And I'm like, wow, you know. And so within that short period of time, I started working for POCAAN. And so that whole first week of getting hired, they had a program, and I just happened to fall in on that week of being hired, where you went to the UW for a whole week every day. That's what you did, and 8 hours a day, and we're trained and educated around HIV and AIDS. One of the things that POCAAN did was we went into did outreach on the streets and went into the drug dens, and, you know, and passed out that's when there's just the needles, the syringes, and the alcohol, you know, and the burners, and passed out all that kinds of materials and things so that people could be educated. And that was the whole premise, you know, was that the education was, but we had to continue to just talk about it and let people ask questions and get all the information they needed to get. So, and then I was hired to work with women and children and families that were HIV infected. And so, and we also had high risk families at that time too. But, so it got to be real intense, because it was working with those, you know, working with families and parents that were infected, children that were infected, and all that was involved with that, you know, getting them to care and dealing with all the stigma and shame and hurt and pain and, you know, everything else, and being the only one in there that knew it, nobody else in the family know, you know. So it's a lot. People got to do what they got to do to get through, you know. So sometimes I get this one girl, she would only use crack every other day. So she would make sure she didn't use it every day. And that was the harm reduction of it. That's what I was able to get her to do. So use crack, and then the other day she would drink some beer. And that's the way it worked. And she was the best mom, the best housekeeper. You could eat off her floor if you wanted to. It was so clean. And her kids were immaculate, and getting her into a different routine and getting that trust built with her, because she was suspect of any and everything, and getting her where she trusted me, and I could go pick her up, take her to the hospital with her kids to get treated, take her to the doctor. That's the way it was. So I transitioned and went into education in the jails and in the prison and prevention work. And that was good. It's another thing I really enjoyed doing because I focus all on education and prevention, going in there and teaching all the ladies all about, we had a 2-day class that happened at Purdy, the women's prison, and I'd go in with all of the safer sex kit and all the materials and everything, and had to get, red badged and everything. So, and I'd have the whole class of the women, and they'd have the class come, and I think we gave them $25. And so we have a nice, group, maybe about 12 to 15, and sometimes more, but then like to keep it at that numbers, and because it would stay in control. And then just, did a whole 2 days of education and information and stories and people talking about the changing their lives and what they're going to do and just all of the different things. But it was education and prevention information was the focus. Then I got into another position that they really wanted me to take was for clinical trials. And another kind of groundbreaking position because it was working and doing education around clinical trials for people of color. People dying, just in a nutshell. And I guess, because that's the end, but I guess the next hardest thing, just on a daily basis, was the stigma and the addiction, drug addiction, because people were so unhealthy because of their drug disease, and then they were using the drugs also because of all of the reasons that people get into drugs, but there was some of the women, they were so ashamed, and they were so and so they were using the drugs because of it was a way to not have to deal with the pain. Seeing people just transition their lives completely, I've loved that, Seeing people get healthy again with HIV, because of the medication, I guess would be the favorite thing for, with HIV, is that, all of the medications were down to, starting off having people taking 12 to 20 pills a day, all the way down to 1 pill a day. That's a big success. I was a shy person, I was, pretty shy as far as, really trying to engage early on and everything. But working with all the different clients and getting all the personalities and having somebody come down and sit and you have to take this assessment and ask them all these questions, and having somebody giving you all that information, and what you're going to do with the information is just try to help them in ways that, you can see what needs to be dealt with and set goals and make some changes and go, and grow in their life. Then what's not to like for me? That's like, it's a win-win. And I love to having a win-win. I don't want to be the only winner. I like to have other people around me winning too.